YouTube and Instagram live. I hope you can hear me properly and the connections are at its place. So if you can't hear me, just you can write down. Then I will adjust the voice on the video. From my side, I hope everything is okay. And let's start the question answer session. Now, last time we had some few cases, where I had prescribed, I had told you some remedies, and with that I had asked the listeners, the doctors and the students to give me the feedback whether that remedy has worked or not. So it's very important on your part also to give me the feedback whether the remedy is working or not. So welcome Dr. Vigyani, Dr. Ruhi, Dr. Isha. So it's important for you also to give me feedback whether the remedy which I have told you in the previous YouTube and Insta, that those working, so that it's very easy for me to know that whatever I want to convey through my clinical experience, that is working with you. Okay, that's very important. Okay, so welcome Dr. Venkat. Before, if you don't have any questions or few questions, I think on the last YouTube and Insta live we had missed because of the time shortage. But still, if you feel there are some new questions, we'll start the new question. Otherwise, we can start. First of all, I'll start sending some, telling some cases. With I hope on YouTube live everybody can hear me properly. Yeah, Dr. Paul, good afternoon. So now it's a winter, it's a transient season where we are coming close to winters, and whenever we come close to winter, there are basically symptoms of cough, cold, and coryza. And it is very important to treat those conditions because if you are able to treat the acute conditions, automatically the patient basically uh, believes in you so much. In this thing, there are two or three things that you have to remember in treating acute cough, which I have seen in my practice. How is the cough, the modality, whether it is dry or wet, and if it is wet, the expectoration. The expectoration is very, very important in cough, and especially if you can get the time of expectoration, that is also very important. See, normally when the patient comes to you and the patient comes and tells you, see, there are remedies where the expectoration is blood-like and bloody sputum and all. I will not go into that because these type of patients don't readily come to us because they go for examination, they go for scans and also they don't come to us. We have cases where we have cough, like for instance, I had a case where the patient says that the cough expectoration, of course, we will not take the blood expectoration, we will say the expectoration color first. Now, whenever the patient comes to you, most of the time the expectoration is, most of the cases, the expectoration is yellowish in color, if I am not mistaken. Patient बोलता है कि भाई मेरा क्या बोलते हैं कफ येलो सामान निकलता है. Now, first of all, before going into the deep modalities, you must know or you must understand there are remedies which have yellow cough. So that you should have at least 5-6 remedy at back of your mind that these remedies have yellow cough. For example, we have pulsatilla, we have Hiparsulf, we have Cilicia, we have Sterum metallicum, we have Calcarea sulf, Calcarea carb for yellow cough. And then you can tell the patient when is the cough and when is the expectoration. Then the patient would say it is more in the morning, more in the evening, more in the night. And then when you have these type of modalities, for example, the patient comes and tells you the expectoration is more in the morning. So whenever the expectoration more in the morning, especially yellow cough, think about pulsatilla, think about sternum metallicum, think about Cilicia, calibichrome, and phosphorus. Then again see how is the expectoration. It is gelatinous, it is viscid, it hangs in long strings, it is watery, and then you can differentiate those type of cases. So it is very important to have a classical modality. Some patient will tell you that there is no expectoration, does not come easily, it comes very, very difficult. He has to do a lot of hawking and the expectoration is difficult. In that case, then you have to think about Seneca, think about Ipecac, think about Causticum, think about Rumex, which I have the same cough. So these are different types of modalities and expectoration color that you have to think in your practice. Of course, furthermore, we can always add welcome Dr. Aurora, Dr. Sairikha. Then the patient comes and tells you, some patient comes, the expectoration is very easy, बस मैं खांसता हूं और मेरा बलगम निकल जाता है बाहर. Then the remedy we have again Sterum metallicum, Natrum sulf, Pulsatilla argentum, Coccus cacti. If you have seen this type of variation, like I said, expectoration difficult, expectoration takes time, it is easy, yellowish in color, especially in morning. If you repeatize this, you will see that one remedy will be there always in 3 marking, and that is pulsatilla. So don't always give pulsatilla, then you have to differentiate pulsatilla cough, bitter taste in the mouth, especially in the morning, or coccus cacti, there's a lot of cough, there's a lot of खड़खड़ खड़खड़ छाती में रहती है, and the expectoration comes, and then patient बोलता है खड़खड़ छाती में रहती है, and the patient is drowsy, then antim tart, खड़खड़ के छाती में रहती है, expectoration आराम से निकल जाता है, बहुत छाती में weakness लगती है, the remedies standard metallicum. So this is how you have to differentiate your remedies in cough. There were a lot of questions, in cough in my WhatsApp group and all, but in general I am telling you that these are the symptoms you have to look forward, and these are the remedies that you have to look forward. Of course, then you can always go, the cough is lumpy, and the remedy, of course, then calcareous sulfur is there, silicia is there. Whatever remedies which I have told you on the first instant, the expectoration, yellowish in color, most of us have these type of complaints. So you have to remember those 7 to 8 remedies which I have told you. Those are very, very important. Second, before the cough becomes yellow, the cough is white in nature. So whenever the patient comes in front of you and says cough is whitish, then again you have to remember remedies like phosphorus, lycopodium, senega, sepia, kali chlor, and nitramur. And again then differentiate morning, like kali bichrome is morning, nitramur is morning, sulfur is morning, phosphorus is morning. So first it would be white, and then it would be yellowish. Then the modality. So this is how you differentiate different type of cough and different type of modality. Then the patient can tell you a very precise modality. Doctor Sahab, whenever I eat, the cough starts, or whenever I finish my eating, the cough starts. Then the remedy becomes silicia. I hope you are understanding, everybody. I go in the open air and I start getting cough. Then the remedy is saccharum alba sepia, which I have lots of cases. I hope everybody is understanding what I mean to tell you. If not, then you can always ask some questions, or you can just give me thumbs up so I know that whatever I am telling you're understanding. Okay, I hope you're understanding that. So this is in generalized which I'm telling you, the cough part, because of the today's season. I hope you're understanding. No thumbs up, nothing. So I'm okay. Everybody's telling okay. In Instagram, I got 100% okay and hearts. So it's very good. Next type of cough. So we have finished white, we have finished yellow, and third part you'll get, and they definitely you'll get that is greenish in color. अब greenish in color, yellowish in color and whitish in color. Yellow आपको बता दिया, white आपको बता दिया. अब greenish cough भी आप ध्यान रखिए, and then we'll sum up कि अगर एक ही patient में 3 remedy में तीनों type को cough कौन से रहते हैं. So whenever you have greenish expectoration, I'm telling you my experience, think about natrum sulf first, think about pulsatilla second, think about phosphorus, then you can think about calcarea silicata, carbon sulf and carbo OH. So these 3 type of cough are there, yellow, white and green. अब सबसे मजे की बात क्या है? There are so many remedies, there are so many remedies which have all the 3 type of cough. White cough also, yellow cough also and green cough also. We have lycopodium, phosphorus, pulsatilla, sepia, carbo OH, sulfur, kali bichrome and calcarea silicata, coccus cacti. Every remedy which I am telling you has all the 3 type of cough. Then it becomes very difficult for you to differentiate. Then you have to have something much more in that. उसके अंदर ऐड कर दीजिए द थर्मल्स, द हॉट पार्ट रहेंगे तो चिली रेमेडीज पूरी अलग हो जाएंगी. उसके अंदर और पार्ट आप ऐड कर देंगे हॉट एंड थर्स्टी, और रेमेडीज कम हो जाएंगी. और यू कैन ऐड chilly and thirstless or chilly and thirsty, automatically most of the remedy would go. For example, if the patient has cough, expectoration है चाहे white है चाहे yellow है चाहे green है, but the patient is chilly, think about sepia, carbo OH, argentum, arsenic, califos, medorinum. And if the patient is chilly and thirstless, these remedies are very important. So this is how you have to differentiate remedies using these modalities, and then you are a good prescriber. Of course, I would not go in for dry cough, Before we go to dry cough, I'll just take one question. Welcome, Dr. Bhumi Bhatt. Patient 85 years, profuse watery discharge after change of weather. Okay. Use natramine or arsenic, pulsatilla, now cough. No improvement after 3 days. What is next, sir? He is a regular CKD patient. If you are treating a case of CKD, and whenever you find that the patient basically has having only cough with no other symptom, and if you feel the CKD is better, Just tell the patient to take some precaution, drink hot water, warm water. Don't have anything cold and all. Don't try to, basically disturb your treatment of CKD, because that's a very grave syphilitic condition. And if you are, it's a wonderful thing that you're able to maintain that CKD in lots of cases. So still, if you feel that you have failed in so many remedies and the patient has nasal discharge also, there are some remedies which I will tell you which will match your case, but make sure that you don't disturb the action of your remedy in CKD. In this case, you can think about first remedy is Corallium rubrum, think about Calibichrome, think about phosphorus, think about Merxol, and think about Calcarea sulf and Calcarea carb. These are the remedies which match your whole case. So whatever chronic remedy you are giving to the patient in CKD, make sure that the remedy is with that and it is in relation to that remedy, so that you don't disturb the action of your chronic remedy for just treating simple case of cough. Yeah, Dr. Krutika, welcome. Dr. Supare, welcome. I hope, Dr. Paul, you got the case, and these are the remedies you should look into it. And especially, these remedies also cover that the discharge is from the posterior nares. In a lot of cases in CKD, the patient is not able to expectorate, and it does like this, and the secretion goes inside, and it sticks. Again, it comes out. Again, it goes back. So these are the remedies which I have seen in my practice, and of course. Natromur was a very important remedy, but if that has failed, so you can try these type of remedies. I hope, Dr. Paul, you understood. If you understand, what I'm answering, you can give thumbs up so I can go further. So there was a question about dry cough. I purposely did not take dry cough because in dry cough everybody is a master. In dry cough we have such beautiful remedies. In dry cough you close your eyes. आप कितने भी नींद आ रही हो, आप कितने भी थके हो, ड्रॉसेरा स्पॉन्ज है तो आप निकाल ही देंगे. So in dry cough, that's why I didn't take anything, because in dry cough, Drosera sponge are very, very important. But just add in your Mater Medica, your notes, always think about Manganum metallicum, one. Of course, after Drosera spongia, think about Hyoscyamus, second. Think about Bryonia, Rumex, and Bromium. Like Hyoscyamus has aggravation lying down, Magnum metallicum is better lying down. Rumex, this type of weather, where the weather is cold weather, it touches the throat and the cough starts. So, and Bryonia, of course, the modality with pain in the chest, and Bromium, you all know that the symptoms of Bromium. So in dry cough, make sure that you use or think about these remedies. These are the most common remedies used in dry cough. Of course, there are so many remedies in the Mater Medica, but normally these remedies have given us very, very good results. So you can take this type of differentiate your Mater Medica, so that automatically your remedy is most of the time right. Of course, people asking me something about Bromium. Yeah, Mulchandani, doctor, welcome. Dr. Gilkudi, welcome. See, in Bromium, one or two symptoms which I have found very, very useful, important of dry cough, you have to remember, In Bromium, the cough is suffocative on swallowing. Patient बोलता है, जब भी मैं सांस लेता हूँ ना, मेरे को बहुत घुटन सा लगता है, मुझे तुरंत पानी पीना है, तो घुटन बहुत लगती है मेरे को. So there is suffocation on swallowing. Very, very important symptom of Bromium, And there is one more symptom of Bromium, that is milk aggravates the cough. Milk aggravates the cough. Of course, when the milk aggravates the cough, you have antimcrude, antimtard, Calicarb also, and sponge also. But Bromium is also there. One thing is, in Bromium, whenever you ask the patient to open his mouth, you will see that the uvula is elongated, especially in the morning. Uvula elongated, that causes cough. You have Hyoscyamus, Calicarb, Bryonia also, but especially in the morning, then the remedy is Bromium. I hope you understood, everybody. Thumbs up and 100% so that we can go ahead. Welcome, Dr. Dipali Raut. So this is Bromium. Now you have to understand how is the cough of Bromium ameliorated. ये भी बहुत इंपॉर्टेंट है. एग्रेशन सब बता दिया मैंने, एमुलेशन बहुत इंपॉर्टेंट है. In Bromium, like spongia, the Cough, there's a dry cough, drinking ameliorates. We have spongia, we have bromium, we have causticum, and we have coccus cacti also. So these are the very, very important symptom of bromium cough, because as soon as I told bromium, you know that I had a question of what about bromium. So this is about bromium. I hope you understood something about bromium, no? And please ask questions, otherwise I keep talking about matermedica and cough and the whole half an hour goes. Before before this, I would like to tell you, so there was a long pending webinar which I had to take, So last year I took 2 webinars back to back, and because of the paucity of time, I could not take. From next month, I am taking a webinar every Thursday, 3 to 4 p.m. in the afternoon. I think you must have got the template of the webinar. So I hope you register as early as possible, so that we have less seats, so that I can deliver a webinar, I can deliver my cases and how I entered the case, how I rubricated the case, and how the remedy is working, and something about the matermedic of the cases also, and the remedy also I'll be describing in at length, So the whole of next month would be booked for webinar every Thursday. So if you have not registered, do register yourself, and we'll enjoy. I enjoy teaching, so I'll enjoy teaching you few of my cases which I have cured in my practice. So I hope I hope everybody got the template of the webinar. I hope everybody got the template. If you have got it, please do the thumbs up, so that I know that everybody knows. Otherwise, the webinar is over and and all the doctors said we did not know. So I hope you know that the webinar is there, and if not, we'll send you the template, either it will be on the Facebook or Instagram, and we'll take the webinar on next month from 2nd of November, that the first Thursday, every Thursday. Okay. Did you get the template? Yes or no? Anybody? Template मिला आपको webinar का? You didn't get? Oh, I am surprised. I'll tell my doctors who are assisting me to send the template. I hope I'll ask them to put on the Facebook. You also, nobody has got that template. Okay. So I have to ask my assistant whether they have put the template properly, or you can visit my Facebook page or Insta page. There's a template there, and you can register. We start on 2nd November, and I think the phone number that is given is that 9011303171. You can call at that number anytime after the webinar and take the details and register yourself for the webinar. Okay, so we'll have hopefully a very good time at the webinar. Okay, so let's go. Any other questions? No. Webinar part is over. You will get the template. I have understood that nobody's got the template, so visit my page on the Instagram or YouTube and LinkedIn also, and I'll put that on my phone number also. This is the phone number. You have to get the phone number and you'll get the link and all. Okay. It is 1 hour every Thursday, and we'll discuss cases and the matermedica. Okay. So I hope you are clear that you will get it. Contact this number and you'll get the dates and all. So let us go further. Yeah, that's why I did not get dry cough, because dry cough, the remedies are very, very easy and all. One thing is very important, in cough, the voice. Always rheumatism alternating with psoriasis. Which remedy to give? Which remedy? Normally I start with 30 potency. Now normally I start with LM potency, because if you want to repeat, I start with LM potency repetition. But if you don't have, you can start with 30 or 200. I give 3 times a day for 2 days and then wait for the results. In fact, I had lots and lots of cases of dengue fever totally cured with homeopathic medicine, totally cured. The platelet count went down to 30,000, but still the patient was not admitted and we treated with homeopathic medicines. डॉक्टर इंद्रनील हैज सबसे पहले डॉक्टर साहब, अगर सोरियासिस के साथ में रोमेटिज्म है तो आपको ध्यान रखना पड़ेगा कि वो सोरियाटिक आर्थराइटिस पे तो नहीं जा रहा है पेशेंट. अगर सोरियाटिक आर्थराइटिस पे पेशेंट जा रहा है, आप दवा देने के बाद सोरियाटिक आर्थराइटिस कम होकर फिर फ्लेयर अप हो रहा है इसके सोरियासिस में, तो वो केस के अंदर सबसे पहले आर्थराइटिस ठीक होना ज़रूरी है. उसके बाद सोरियासिस ठीक होना ज़रूरी है। सोरियासिस इतनी ज़्यादा ऑटोइम्यून डिसऑर्डर है, और मैंने कितनी बार बताया सोरियासिस के बारे में, इट इज़ बेसिकली बिकॉज ऑफ सप्रेशन। अगर आपने मेरा यूट्यूब या इंस्टा लाइव देखा होगा तो आप देखेंगे कि मैंने सोरियासिस पे काफ़ी हद तक बोला है, और बहुत अच्छे रिजल्ट है सोरियासिस के मेरे पास। बट मैंने कभी ये ऑल्टरनेटिव पार्ट में सोरियासिस में ट्रीटमेंट नहीं किया, बिकॉज मेक श्योर अगर सोरियाटिक आर्थराइटिस है तो उसको सप्रेस मत करिए। अगर सोरियाटिक आर्थराइटिस सप्रेस हो गया तो मेरे पास पेशेंट्स है तो बेचारे बेड से उठ भी नहीं पाते हैं। तो फर्स्ट ऑफ ऑल आर्थराइटिस ठीक होना जरूरी है, उसके बाद सोरियासिस। सो केस के अंदर सप्रेशन देखिए कहाँ सप्रेशन हो रहा है। इसलिए जो मेरे असिस्टेंट डॉक्टर्स हैं जो मेरे साथ काम कर रहे हैं, ये उनका बेसिकली इनिशिएटिव है कि मैं वेबिनार लूँ और लोगों को बताऊँ कि होम्योपैथी बहुत ईजी है। उनको बहुत लगता है ईजी है बिकॉज मैं ईजी बताता हूँ सब कुछ। सो इन केस के अंदर आप पूरा हिस्ट्री लीजिए और देखिए कहाँ सप्रेशन हुआ है, उसके बाद ही हम सोरियासिस ट्रीटमेंट शुरू कर सकते हैं। ऑल्टरनेटिंग पार्ट के मैंने अंदर कभी क्योर नहीं किया है, मैंने कभी उसमें प्रिस्क्राइब नहीं किया डॉक्टर इंद्रनील। हालांकि दवाई मुझे पता है, बट मैंने कभी वो दवाई दिया नहीं है ये सिम्टम के अंदर। ओके अन्ना, वेलकम। फीमेल पेशेंट हैज डिस्निया फ्रॉम लिटिल एक्सर्शन, HB नॉर्मल, नो अस्थमा, एलर्जिक राइनाइटिस, एग्रेवेशन डस्ट, स्मोक, आर्सेनिक, थूजा, नेट्रम, सल्फ, फेल्ड। सी जब भी हमारे पास कोई पेशेंट आता है, आपका नाम क्या डॉक्टर साहब मुझे पता नहीं है, जब भी हमारे पास कोई डॉक्टर आता है, सॉरी पेशेंट आता है, अभी आप देखेंगे डस्ट के अंदर खांसी आना काफ़ी कॉमन है, डस्ट। अभी जब भी हम जैसे मेरे को भी खांसी है तो कभी भी हम डस्ट इनहेल करते हैं, जब भी हम डस्ट इनहेल करते हैं और हमको बहुत खांसी आती है, there are two remedies which are very very important. If you don't get the remedy right, or patient is telling you that because of inhalation of dust I have the problem, think about two remedy, and the first remedy is bromium. पेशेंट डस्ट में जाता है, बहुत खांसता है, गाड़ी रुकाता है, थोड़ा पानी पीता है, उसको अच्छा लगता है, फिर आगे जाता है, फिर खांसी आती है बिकॉज ऑफ डस्ट, एंड ही टेल्स द ड्राइवर कि एक पानी की बोतल लेके आओ, वो पानी पीता है, उसको अच्छा लगता है। बस पेशेंट ये सिम्टम बोला, ब्रोमियम देने का आपको, समझ रहे हैं, गिव ब्रोमियम। फिर भी पेशेंट बोलता है नहीं, खांसते खांसते मेरे आंखों से पानी आना शुरू हो गया है, माय डियर डॉक्टर गिव नेट्रम्यूर। ये सिम्टम बोलने की जरूरत नहीं, ये पेशेंट आपको सिम्टम बताएंगे, मैं कार में जा रहा था एंड ये सिम्टम हुआ, मैं स्कूटर रोका, पानी पिया, मुझे अच्छा लगा, दैट्स द रेमेडी, ब्रोमियम और नेट्रम्यूर। ओके। सेकेंड, पेशेंट को लगता है कि भी मेरे को खांसी है, और जब भी मैं मेरे को अस्थमा होता है, जब भी मैं बाहर जाता हूँ, डस्ट में क्या मेरे को सांस में तकलीफ होती है, देन यू मस्ट थिंक अबाउट फर्स्ट रेमेडी, प्लीज राइट डाउन इन योर बुक। फर्स्ट इज सिलिशिया, second is hepar sulf, and third remedy you'll be surprised is calcarea carb. Arsenic is there, but calcarea carb has given me very good results. Asthma from inhaling dust, are you getting me? डॉक्टर साहब आपको समझ में आ रहा है? समझ में आ रहा है? सो अस्थमा फ्रॉम इनहेलिंग डस्ट। और तीसरा पार्ट आपने बोला है कि भाई जब भी एक्सपेक्टोरेशन निकलता है, पेशेंट बोलता है मुझे उसमें डस्ट के पार्टिकल दिखते हैं, ऐसी गंदगी, काला काला दिखता है। यू मस्ट थिंक अबाउट द फर्स्ट रेमेडी इज फॉस्फोरस एंड नक्स ओमेगा। ओके, एक मिनट। इंद्रनील सर, इन पॉजिटिव ऑफ सिम्टम्स एंड साइकोसिस सीन डोमिनेटिंग, कैन वी गिव थूजा एज इंटरकरेंट और शुड गिव मेडोरिनम? नहीं, ये इंटरकरेंट का कंसेप्ट मैं तो प्रिस्क्राइब नहीं करता हूँ ऐसा, बट डोमिनेटिंग कैसे? डोमिनेटिंग उसके पेरेंट्स का डोमिनेटिंग है, उसके बड़े भाई का डोमिनेंस है, उसके चाचा का डोमिनेंस है, उसको खुद अपने बॉस का डोमिनेंस है, उसको वर्क का डोमिनेंस है, उसको खुद को अपने आप के डोमिनेंस है। मतलब उसने अपने इतने हाई स्टैंडर्ड्स बना दिया है कि भाई मेरे को होना ही चाहिए, मेरे को रिजल्ट आना ही चाहिए, मेरे को आना ही चाहिए, तो खुद के डोमिनेंस से मर जाता है वो। तो ये एक पार्ट ऑफ डोमिनेंस हो गया। फिर गुस्सा बहुत ज़्यादा, उसने वहाँ कुछ सप्रेस किया है, जिसको बहुत बोलना था बोल नहीं पाया। फिर वो सोचते कि यार मेरे को वहाँ बोल देना चाहिए था, मैंने क्यों नहीं बोला, और वो सोचते सोचते उसमें सप्रेस हो जाता है उसके ऊपर, एंड देन सोरियासिस स्टार्ट्स। सो दिस इज वेरी इंपॉर्टेंट डॉक्टर इंद्रनील, ये आपको ध्यान रखना पड़ेगा। ओके, मिलेगा आपको, केस मिलने वाला है डोमिनेंस पे, सोरियासिस में आई कैन नेवर फेल। और वही हम कोशिश कर रहे हैं, मेरे असिस्टेंट डॉक्टर्स जो है वही कोशिश कर रहे हैं बताने के लिए बहुत लोग को, तो हमको कैसा इजी अप्रोच करना चाहिए क्योर करने के लिए। बीमारी ठीक करने के लिए बहुत इंपॉर्टेंट है. अदरवाइज यू कैन गो इन लॉट ऑफ फिलोसफी, बट मेरे पास ऐसी ऐसी केसेस है जो बहुत इजीली ठीक हो गए हैं. सो दैट इज वो इंपॉर्टेंट. नो, फिजिकल जनरल्स डोमिनेट. नो नो. Whatever I have cured in case of psoriasis, I have always got the mind dominance in my practice. So if you ask me in psoriasis, mind dominance is very, very important, and that will lead you to the prescription of remedy. Okay? Hoarseness of voice since 1 month, video laryngoscope revealed normal chord. ये तो सबसे बहुत इंपॉर्टेंट है, होम्योपैथी में अपने को मिलता है वॉइस हॉर्स, लेकिन अभी आपको ये ध्यान रखना है डॉक्टर वेंकट, अभी हॉर्सनेस ऑफ वॉइस है तो उसको बोलने में तकलीफ हो रही है कि नहीं हो रही है? इज इट पेनफुल और पेनलेस? बस ये आपको आ गया और आपको दवाई आ जाएगा. फॉर एग्जाम्पल, अगर पेशेंट आके बोलता कि मेरा हॉर्सनेस बहुत पेनफुल है, बहुत तकलीफ होती बोलने में, तो आप लेंगे पेनफुल. और उसको इतना हॉइस है, चिल्ला चिल्ला के बोल रहा बट दर्द ही नहीं हो रहा. सो पेनलेस हॉर्सनेस, कैलकेरा सिलिकेटा, कार्बोवेज, एंटीमक्रूड, बट पेनफुल है, उसको बहुत दर्द कर रहा बोलने के टाइम पे, तो हमारे ड्रग चेंज हो जाते हैं. जैसे फॉर एग्जाम्पल पेशेंट बोलता है मैं बहुत बात किया और मेरा गला बैठ गया है, तो उसके बाद हम लेंगे अलग दवाई. बट पेनफुल के अंदर वी हैव फॉस्फोरस, वी हैव बेलोडोना, वी हैव कालीब्रोम, वी हैव ब्रोमियम ऑल्सो. सो आपको डिफ्रेंशिएट करना पड़ेगा. डिफ्रेंशिएट किया डायरेक्ट रेमेडी आ जाएंगे आपको. फ्रॉम ओवर यूज ऑफ द वॉइस, फ्रॉम म्यूकस इन द लैरिंग्स, फ्रॉम सिंगिंग, फ्रॉम पीरियोडिकल, क्रॉनिक. सो ये आप डिफ्रेंशिएट करते आएंगे, रेमेडी आपके पास आती जाएंगी. हे जोशी, sir, already seen, posted on WhatsApp. Okay, okay, Dr. Hetal, Dr. Joshi. Venkat says vocal cord, yeah, nodule also, no? तो नोड्यूल के कुछ तो सिम्टम होने चाहिए ना. वोकल कॉर्ड में नोड्यूल है तो नोड्यूल के कुछ तो सिम्टम होना चाहिए ना. वोकल कॉर्ड में कुछ तो सिम्टम आना चाहिए. ऐसा कोई भी रेमेडी या कोई भी पेशेंट नहीं बनेगा जिसको कोई सिम्टम ही ना हो. हाँ, अगर उसके इसमें आ गया कि नोड्यूल है, ऑफकोर्स अच्छी बात है. हम वो नोड्यूल पे क्या उस पर नहीं प्रिस्क्राइब करेंगे, कैलकेरा फ्लोर दो कि क्या फाइटोलिका दो, कि वो सब नहीं. हम उसके सिम्टम देखेंगे ना, सिम्टम क्या है. एंड व्हेन वी गेट सिम्टम, ऑटोमेटिकली आवर प्रिस्क्रिप्शन और रेमेडी बिकम्स वेरी इजी टू गेट. सो ट्राई टू गेट द सिम्टम, बिकॉज ऑफ दैट व्हाट इज द प्रॉब्लम. प्रेशर सिम्टम्स है, ताकत लगा के बोलना पड़ रहा है, पूरी नसें दिखती है बोलते बोलते, पेनफुल है, पेनलेस है, ऐसे बहुत सारे सिम्टम्स है जो हमको उसको इंडिविजुअलाइज करना पड़ेगा, एंड देन यू कैन गेट द रेमेडी. शेयर व्हाट्सअप नंबर ऑन डिस्क्रिप्शन ऑल्सो. मेरा नंबर लिख लीजिए डॉक्टर साई रेखा, 9011-303-171, बिकॉज मेरे असिस्टेंट लोग फिलहाल नहीं है, बिकॉज आई डोंट नो हाउ टू ऐड दैट. सो 9011-303-171. So as we go further, acidity better after eating for some time, then the burning resumes. Yeah, ये तो आप see, you will see lots in this case in your practice. There are a lot of cases where the patient says, whenever I eat something, I feel better, and after some time it again resumes. So don't go in this symptom, acidity and burning and all. Eating ameliorates. No, whenever you say that I eat something, and don't go in the symptom where you have to prescribe only for that part of stomach. Then you have to go for generalized thinking. But eating better, eating ameliorates. Then if you use Fataka, eating ameliorates. Then you have to say remedies like Chiliodonium, Graphitis, Zincum metallicum, Bovista, Anacardium. Eating ameliorates. One thing, if the patient adds eating fruits ameliorates, then you have to think about Lycopodium. Okay? So this is how you try to differentiate your mater medica. Okay? So many doctors on WhatsApp. Last time we had 148 doctors on WhatsApp, but questions were very few on YouTube. So I try to ask questions and be very fast, and so that I will be able to. In fact, if I ask you, cough better by eating, which remedy comes to your mind? Anybody? Let me ask one question. Cough better by eating. Anybody? डॉक्टर साहब मेरे को बहुत खांसी आती है, लेकिन कुछ ना कुछ फ्रूट खाता. स्पंजा, yes, very good. Sponja. There are 2-3 remedies very, very important. The first remedy is sponja. Second remedy, my dear friends, write down, it is euphrasia. And third remedy, my dear friends, write down, it is radium brome. Very, very important remedy. Spongia is a fantastic remedy. Eating fruits ameliorate. And exactly opposite you have to understand, eating fruits aggravates. Then you have to have the remedy which I told you, magnesium mure, and one more remedy, that is argentum muriaticum. Both mures, magnesium mure and argentum mure. Okay, let us go further. Will not waste time on matter medic. Okay, sir, please share the approach in case of neurological disorders. Dr. Dipali Raut. See, now it will be very short time. We have very short time. It's a very wide topic, But definitely I'll share this on webinar. I'll put that note, and I'll tell my associate doctors to put this question. I'll share there on the webinar which I'm taking next month. It will be a long thing to discuss, So if you cannot join the webinar, I'll discuss in the next YouTube or Insta Live. Okay. 50 years oral lichen planus vitis diabetic cannot control least spicy food and bad effects of tobacco chewing and stress due to fear of cancer. Lichen planus, most of the patient will have fear of cancer, which I have seen, diabetes. So it is a classical out and out syphilitic case, lichen planus, psychosyphilitic case. Make sure why did the patient suffer from lichen planus, first of all. Then you have to understand how did Pura, we said spongia. So if you ask me remedies in this case, you can write down few remedies. There are fear of cancer. There are a lot of patients who have fear of cancer. So if you want remedy wise, you can write down. Whenever you have fear of anything, first remedy you must think about is calcarea carb. Second remedy you must think about is arsenic, and the third remedy you must think about is soranum. One remedy of late which I have got a lot of results, that is mancinella. MANCINELLA. Fear of cancer, mancinella, very important remedy. I have used in one or two sporadic cases, but good results. So calcarea carb, arsenic, soranum, mancinella, and one more remedy would be kaliars. Yes, Dr. Purva, we have finished that. Radium brome, spongia, and there's one more remedy, euphrasia. Okay, so I have done my duty, some marketing part of my webinar, and next month we are starting that webinar, 4 session every Thursday. I have told you the phone number also. Do contact at that number, and please do the formalities so that in Zoom, we have good amount of people, and then we can discuss and see how does that discussion help in your practice. Okay, so time is up, and thank you all. Thank you for joining. I hope you enjoyed as much as I enjoyed sharing and teaching you all, and do share your results or post your results so that everybody learns with that. Okay, thank you so much.